House 223 and S 130, an act relative to a livable wage for human service workers. We're going to start in person, and Bill Yelenak, the Providers Council.
Good afternoon. Good afternoon. Chair Kennedy, Chair Livingstone, members of the Joint Committee on Children, Families, and Persons with Disabilities, thank you for the opportunity to provide testimony in support of House Bill 223 and Senate Bill 130, legislation that would provide a livable wage to community-based human service workers by eliminating the pay disparity that exists between them and state employees with similar job titles and functions. My name is Bill Yelenak, and I'm the President and CEO of Providers Council, the state's largest association of private, community-based human services organizations that provide a variety of services to hundreds of thousands of residents on behalf of the Commonwealth. I'm thankful to be before you today to discuss a pay disparity that has created a two-tiered system of care in Massachusetts and exacerbated a workforce crisis in the community-based human services sector. Direct care workers, nurses, clinicians, and others in this sector often receive a salary that is significantly lower than those working at state-operated human services programs due to low salary benchmarks being used in rate setting. This legislation would eliminate that pay disparity. We greatly appreciate the legislature's historic support of human services and of Chapter 257, the landmark rate-setting law passed unanimously by the House and Senate in 2008. Additionally, the legislature in its FY25 budget included a provision mandating EOHHS do a report on the pay disparity between community-based workers and state workers. This report was sent on July 2nd to the House and Senate Ways and Means Committees as well as EOAF. We've included the full report in our written testimony, which I believe you have, and it details the disparity in the following ways. The state sets the benchmark for a Direct Care 1 staff member in the community-based human services sector at just $20.79 an hour. Yet the state pays its similar worker, a developmental services worker 1, an average of $23.51 an hour, or 13% more. Similarly, the Direct Care 3 job makes just more than $27 an hour, while the state role makes $31.25 an hour, a difference of 15%. State-employed social workers are paid on average between 11% and 47% more. State-employed nursing assistants, LPNs, and RNs receive between 1% and 16% more. And other positions have larger salary gaps, including OTs, PTs, psychologists, and speech-language pathologists who make, on average, 37 to 58% more working for the state versus the community-based sector. Our members will provide further testimony on how this impacts their workforce and the consumers to whom they provide care. This is also an equity issue. Nearly 80% of the workers in our sector are women, and 36% are people of color, percentages that far exceed other sectors. Our inability to recruit and retain workers can put lives and families at risk. This legislation being heard today would eliminate this pay disparity gradually through July 1st, 2029, at which point it would be completely eliminated. We'll file more comprehensive written testimony on these bills, which were reported out favorably by this committee last session. I'm happy to connect at your convenience to discuss this in more detail. Thank you for your time today, your continued support of human services, and of course, your consideration of this critical legislation.
Thank you so much, and thank you. I realize I didn't mention in the beginning, but thank you for setting the standard that we will have a 3-minute time limit for testimony, so you nailed it right on the head to set the tone for today. So thank you so much. Are there any questions of the committee? Thank you so much for your testimony and the additional written you'll provide.
Of course. Thank you. And I'd like to recognize Representative Donahue. Thank you.
Okay, up next we have Craig.
Oh, and Representative Fields. Sorry.
Thank you. Craig Gordon with Communities for People.
Chair Kennedy, Chair Livingstone, members of the committee, I'm Craig Gordon. I'm with Communities for People. I'm the President and CEO. Bill gave you a high-level overview. I wanted to spend my time actually giving you a little bit of a sense of how turnover and vacancies impact one human service agency. So Communities People is based out of Kenmore Square. We have a bunch of contracts with DCF and DYS for residential programs, group homes, semi-independent living, family support, lead agencies. So we're not a small agency, we're not a large agency. We're touching the lives of about 175 youth and families in the Commonwealth every single day, predominantly in Metro Boston. And we do that with a staff of about 115 staff when those positions are filled. Unfortunately, we probably run between 25 and 35 positions vacant for the past year. It's about a 30% vacancy factor. And I just want to give you a little glimpse of what that might be like for a youth, let's say a teen boy living in a group home, who's wondering who is going to be working with him that day. And whether it's a group home or a foster home or our family support programs, the answer is it differs. And sometimes we're using temporary staff. Our staff are not interchangeable commodities. When we hire someone, when we retain someone, we're making a promise that that person is going to show up and be there for that youth, for that parent, for that family. And whenever those positions are vacant, we break that promise. And we just really need to change it. Not all of these positions are vacant because they are moving to state-funded positions, but some do. We certainly have many people who leave our programs and go on to state-operated programs. The second point I wanted to make is in the 70s and 80s, when the Commonwealth was building out the array of community-based programs and building a service array, prospective employees had a choice. They would work for those private agencies and actually make more. Or they could work for the state in a state-operated program and get paid less, but they'd get better retirement benefits, better healthcare benefits, better fringe benefits. That choice has not been true for many, many years. So both of these bills taken together give you an actionable path and roadmap to be able to address some systemic inequities. Thank you.
Thank you so much for your testimony. Any questions?
Yes, thank you, and thank you for making the trip from Kenmore Square.
Thank you for having visited our programs.
No problem. For the vacancy rate of 30%, do you find that to be increasing or decreasing or staying the same?
We have not recovered from the pandemic yet. So the answer is it's been pretty stable for at least a couple of years.
Thank you.
Sure. Thank
Any
you.
questions? Thank you so much. And I want to recognize Vice Chair Senator Miranda has joined us online. Okay, up next we have Tammy Mello with the KEY program.
Good afternoon. Chair Kennedy, Chair Livingstone, members of the committee, thank you very much for having this opportunity today to testify on behalf of House Bill 223 and Senate Bill 130. My name is Tammy Mello. I'm the president and CEO of the KEY program. We're a community-based organization that provides services all across the Commonwealth, except for Boston, where my colleague Craig provides services. I have 33 years of experience in child welfare work. In the last 4, I've been honored to serve in an organization that provides an array of continuum of services, from community-based in-home supports, in-school supports, a trauma clinic, outpatient clinical services, as well as group homes for children and youth and families across the Commonwealth. I value what state agencies and the employees that they bring to this work, as well as the nonprofit sector bring, and their shared commitment to safety, permanency, and well-being for children. That said, you heard about the disparities, and so I'm going to I did provide written testimony. I'm going to try to not repeat what has already been said. Community-based providers like ours serve children, youth, and families across the Commonwealth, many of whom have experienced trauma and adversity. That's one of the things that makes us very different, and we know that livable wages is a common conversation that has happened all across the Commonwealth and the country. The work is challenging, but it's also incredibly rewarding. To do the work, we must recruit and retain staff. You heard about vacancy rates from Craig, my colleague, but to give you an idea of the consequences of the pay disparity between state agencies and community nonprofits, over the past year, so fiscal year 2025, we hired 146 new employees. We're an agency that employs about 400 employees. We hired 146. We had about the same number leave. And we always ask why. Why are people leaving? And the top 2 reasons are personal. And the personal, when we dig a little deeper, it's just really hard, stressful work. And the second reason is they are finding jobs in state agencies and for-profit agencies where they are getting paid more, they are entitled to retirement benefits, et cetera. So despite these challenges, we keep at it. We recently did a survey in July of this year where we asked the youth that we serve what they thought about the work that we did, because we know that that's incredibly important. We had 303 youth in the month of July respond to our survey. They reported how much they value the services, the importance of the consistency of the staffing, which you heard from Craig, and the trusted relationships that staff provided. When staff leave, young people feel that loss deeply. It can mean starting over with someone new when what they need most is trust and stability. Despite the challenges, our workforce remains committed. They love their work and the young people they serve, but the love of the work cannot be the only thing that sustains them. Fair, competitive wages are essential.
Tammy, thank you so much.
Oh,
I apologize.
thank you.
You've
That's
hit the
okay.
clock, but thank you so much. And I want to particularly thank you for bringing the voices of the young people served. It's so important with this that we are speaking about the employees, but the impact on the children that they're serving cannot be forgotten. So thank you for
Absolutely.
that. Any questions amongst the committee?
Great, thank you.
Okay, we're going to move online. We have Peter Evers with BAMSI.
Hi, thank you for hearing my testimony, chairpersons and members of the Joint Committee on Children, Families and Persons with Disabilities. My name is Peter Evers, and I serve as the President and CEO, President and CEO of BAMSI, a full-service human services organization that supports over 55,000 individuals across southeastern and central Mass. I'm speaking to our strong support for House Bill 223 and Senate Bill 130, an act relative to the livable wage for human service workers. This legislation addresses a long-standing and deeply harmful disparity in compensation between human service workers employed by community-based nonprofits and those employed directly by the Commonwealth. Despite performing similar work, often with the same job titles, community-based workers are paid significantly less. This inequity undermines the stability of our workforce and threatens the continuity of care for the most vulnerable residents in Massachusetts. Senator Kennedy, you have visited one of our homes, Salisbury Street in Worcester, and it actually does care for the most vulnerable folks who are on vents 24 hours a day. At BAMSI, we see firsthand the consequences of this wage gap. Dedicated professionals who provide essential services, mental health support, developmental disability care, housing assistance, and more, struggle to make ends meet. Many leave the field entirely, not because they lack passion or commitment, but because they can't afford to stay. This turnover disrupts care, increases costs, and diminishes the outcomes for those who we serve. This bill will affect around about 160,000 jobs statewide. The Commonwealth is the largest purchaser of human services from organizations like BAMSI. It is both fiscally responsible and morally imperative that the state ensure fair compensation for those delivering these services, which are the same. We'll also go a good distance to solving recruitment and retention issues that have been evident for BAMSI and our colleagues over the many years now. By passing this legislation, you will help stabilize the workforce, improve service quality, and affirm the dignity of those who we care for in our neighborhoods. I urge you to support House Bill 223 and Senate Bill 130 and to prioritize funding that reflects the true value of human services work. Thank you for your time.
Thank you. Thank you for your work. Any questions from the committee? Thank you so much. Okay, we're going to move on to House 224, Senate 160, an act improving accessibility in the creative economy. We're going to stay online, beginning with Margaret Keller.